A warm welcome to the introduction of the KaVo uniQa dental unit. You have the option to watch the entire video or select specific sections. Sabine Ludwig will guide you through the training. The patient chair is designed for a patient weight of up to 185 kilograms. The chair can be moved in 3 ways when the instruments are put down. The first option is using the foot control. If the cross switch is pushed forwards, the chair moves upwards. Pulling the cross switch backwards, the chair moves downwards. Cross switch to the left, the backrest goes backwards. Cross switch to the right, the chair backrest moves upwards or forwards. The second option is moving the chair at the dentist element. Using the chair cross, the patient chair can be moved up and down, and the backrest can be moved forwards and backwards. The third option for controlling the patient chair is the assistant element. The arrow buttons indicate the direction of movement. To move the headrest, press the button on the right and adjust the headrest. After releasing the button, the headrest is fixed again. It is also easy to operate from the assistant side. The upholstery itself is a reversible cushion. Here you can see the basic position, which is designed for treating adults. For treating children, the upholstery can simply be removed, turned over, and snapped back on. The transition from the backrest to the cushion is now flatter. The head upholstery can easily be replaced with a comfort head cushion with magnetic holder. Remove the standard upholstery, attach the magnetic plate, then fit the comfort cushion. The optional armrests can be swiveled forward on both sides. The armrest facing the device body can alternatively be fixed in place. The C-curve can optionally be configured with lighting. The lighting can be deactivated in the settings. The dental unit has several safety functions. On the backrest, in the swivel area of the spittoon bowl, the base plate, the bracket of the foot control, and at the foot end of the seat. If a safety cutout switch is active due to blockage, a red bar appears in the display and LEDs on the assistant element flash. After tapping on the arrow, details are displayed. If a safety cutout is active, the chair can no longer be moved. In the shock position, the patient chair moves all the way up and the backrest all the way down. This stabilizes the circulation of a patient who is feeling unwell during treatment. To remove the premium footrest cover, gently loosen the fastening tabs on the upholstery, then tilt towards the foot end and pull off. To attach the premium footrest cover, first hook it into the center of the footrest end from below, then tilt it over the upholstery. Finally, gently stretch the fastening tabs over the cushion. The touchscreen of the KaVo uniQa is divided into 2 parts. On the left is the user selection, as well as the control panel for manual patient chair movements and the programmable automatic positions. Furthermore, the home screen can be extended with individual functions by each user. The left part of the display remains visible throughout the entire treatment. The treatment types can be selected on the right-hand side. When an instrument is removed, the instrument functions are displayed here. By clicking on the drop-down menu, a created user can be selected. The language can be set for each configured user. In the Settings menu, select User and then the language selection using the arrow key. The list of available languages is displayed. Here we choose German, for example. Then back to the overview. The language has been adjusted. We recommend programming the entry and exit position for position 0, as well as saving a lower jaw and upper jaw position. The positions can be saved according to the practitioner. This is how the chair positions can be set. Move the chair manually to the desired position. When the position has been reached, press the button to be programmed for 4 seconds, in this case, position 0. Confirm the save in the pop-up menu. The image on the display changes, according to the newly programmed position. Now move the chair manually to the next desired base position, for example, lower jaw treatment. Press the second button, in our case, automatic position 1, for 4 seconds. Confirm the save and carry out the same procedure for automatic position 2. For treatment, first move the patient to the corresponding automatic position. Then use the manual fine adjustment depending on your patient's size. If you want to have them rinse, you can move them to the rinse position using the SP button. The treatment light goes off automatically and the cuspidor is rinsed automatically. It can be swiveled in manually. A signal tone sounds when the parking position is reached. It can be deactivated in the settings. By pressing the LP button, the patient chair automatically returns to the last position and you can continue the treatment. The treatment light comes on again automatically. With the foot control, when instruments are put down, the rinse position can be accessed on the right. The last position can be accessed on the left. All automatic positions can be accessed via the assistant element. The home screen can be personalized. Press Settings, select User, and in the following menu, press the Home Screen button at the very bottom. The home screen can now be customized. First, remove the buttons that are not needed. Now, drag down all the buttons for the desired functions. For example, after the shock position, filling mouth rinse cup, bowl rinse, treatment light on/off, the compo shape mode, and the screen lock. Alternatively, there is also a bell symbol for connecting to a door opener or bell. In the Treatment tab, the newly set up home screen can be seen directly. Not all home screen positions need to be filled. A brief activation of the mouth rinse cup button fills the cup. The fill amount of the mouth rinse cup can be set and saved. To do this, hold down the mouth rinse cup button. After 4 seconds, the save menu opens automatically and water begins to flow into the cup. You determine the fill amount by releasing the button. The rinse duration of the bowl can also be set and saved. On the home screen, hold down the bowl rinse button. After 4 seconds, the save menu opens automatically and water begins to flow. You determine the rinse duration by releasing the button. A brief touch of the button activates the bowl rinse. The filling of the mouth rinse cup and the rinsing of the bowl can also be activated from the assistant side and set in the same way. On the home screen, the touch display of the dentist and assistant elements can be locked simultaneously. To do this, the button with the lock is pressed. The screen lock is needed, for example, when cleaning the display. To unlock, the main pedal of the foot control must be pressed for 2 seconds. A screen lock is also possible from the assistant element. To do this, simply press the KaVo logo. The KaVo uniQa offers the possibility to pre-select 3 treatment types and save parameters. Tap on the blue bar. The drop-down menu shows excavation, preparation, prophylaxis, and manual. All other menu items displayed are optional accessories. The first 3 treatment types can be renamed individually. Select, for example, excavation. Excavation appears in the blue menu bar. The instruments used and individual parameters can now be saved for this type of treatment. Remove the instrument, in this case a turbine, from the holder. When the turbine is removed, the preset speed is displayed. By clicking on the RPM display, the speed setting can be changed to percentage. The speed can be adjusted using the slider. The spray behavior can also be saved. Spray off, spray on, or air only. Press the save button to save. The same applies to a motor. Set the desired speed and select the spray setting. Select clockwise or counterclockwise motor rotation. The parameters are saved using the Save button. In the manual treatment mode, no settings are saved on the display. They can be set individually for each treatment using the foot control. The center positioning of the foot pedal is deactivated. When the instrument is removed, the values that were last used are retrieved. The handpiece of the E-scaler can be easily and securely attached to the hose in the specified position. The power can be regulated in 10 stages using a control. The power can also be regulated via the foot control. Please note the recommended power settings. The water volume can be adjusted using the regulating ring. The front grip sleeve can simply be unscrewed, allowing the light guide and LED module to be replaced in practice. The left button of the 3 or multifunction handpiece controls air, the right button controls water. Pressing both buttons together produces the spray. For the multifunction handpiece, the heating of the media can be pre-selected on the display. In the settings, you can select whether the instrument light switches on when the respective instrument is activated or when it is removed. This is an overall setting that affects all instruments. If you have equipped your uniQa with an endodontics or surgery function, you will find all the details on the setting options and helpful tips in the separate videos on the 2 options. Five different timers can be programmed in the timer menu. To set a timer, press the arrow button. You can choose whether it should be a stopwatch or a countdown. For the countdown, adjust the time and press confirm. The setting is saved. To start the timer, press the large button. Even when the timer menu is exited, for example for treatment, the countdown remains visible in the status bar. Alternatively or additionally, a stopwatch can also be started. This is also displayed in the status bar. To stop, press the large button again. A signal tone sounds when the timer expires. If you have equipped your uniQa with Connect Base, the activated timers are also displayed on the KaVo screen. You start your patient communication via the Multimedia tab. Detailed information on this can be found in the separate videos on the multimedia systems and intraoral cameras. The dental unit offers a range of automatic cleaning programs, including intuitive step-by-step instructions. In the Hygiene tab, tap the Cleaning Position button to move the chair into the cleaning position. Then select the desired cleaning program. The respective hygiene guide appears on the display. You can see further steps of the hygiene processes in the detailed hygiene video. The settings area is divided into personal user settings and general settings. Up to 6 users can be created in the personal settings. You can rename the username in the user settings. The first 3 indications can also be retitled. You'll also find the language and light settings here, as well as selection buttons for the personal home screen. In the general settings, you'll find information about your dental unit and your specialist dealer's contact details, amongst other things. The dental unit's arm system is adjusted so that it remains at any height under normal load. To ensure it holds even under heavy load, the arm system features a float brake that can be adjusted using the screw. The dentist element of the KaVo uniQa is also available as a swing arm. The display operation corresponds to the operation of the T-table version. Only the size and orientation of the display is different. The instrumentation is freely selectable and the swing arms are available with or without a locking mechanism. The version with locking mechanism has 3 locking positions. Pull the instrument to the desired locking position. To return it, pull the swing arm slightly forwards and put the instrument down again. To obtain maximum hose length, fully extend the swing arm and it will lock into place. Pull once more and the swing arm retracts. The optional tray shelf can be mounted at 4 different positions on the underside and can be positioned flexibly. The foot control of the KaVo uniQa offers a wide range of functions. For example, The stored treatment types can be selected and called up using the main pedal. Once the required treatment type has been selected and the instrument removed from the holder, the speed can be controlled using the foot pedal. Here with an electric motor from 100 to 40,000 revolutions per minute. When the pedal is released, it returns to the center position at the preset speed. In the manual treatment mode, there is no center positioning for the foot pedal. The speed can be adjusted continuously by moving the foot pedal horizontally. The pedal remains in the position and therefore at the speed at which it was last operated. The left button of the foot control switches the spray modes when the instrument is removed. The cross switch in the center of the foot control activates reverse rotation for a motor. The right button triggers a chip blower function for rotating instruments. The enhanced air blast safely and quickly removes debris at the preparation site without activating the rotating movement. With instruments stowed away, the chair functions can be controlled via the foot control. If you have equipped your KaVo uniQa with a wireless foot control, a warning message will appear on the touch display when its battery charge is still 30%. At the same time, the foot control emits a beep sound with each activation. The wireless foot control can be easily recharged overnight, for example, using a plug-in power adapter. The on-off switch usually doesn't need to be operated. It's used to restore broken connections between the foot control and the dental unit. The treatment light can be switched on or off on the home screen using the light button. The compo shape mode can be controlled using the compo shape button. The same control options and buttons can also be found on the assistant element. The KaVo Lumina can also be controlled via the sensor on the light. Move your hand past the sensor to switch the light on and off. The compo shape mode is activated when the hand approaches the sensor briefly and is immediately removed again. This activation can also be performed directly from the switched off state. Further details on the setting options and operation of the KaVo Lumina can be found in the Lumina instruction video. The assistant element is height adjustable in stages. After the highest locking stage, the element can be returned to the lowest. The operation corresponds to the operation on the dentist element, manual chair movement, automatic positions, rinse positions, last position. Furthermore, lighting control, cup filler, bowl rinsing and the first 3 timers, as well as the display lock for dentist and assistant elements with the KaVo logo. An additional tray holder can be fitted as an option. The PHYSIO Evo has a lever under the front left seat. To adjust the height of the chair, pull the lever. The back lever allows you to adjust the backrest. Press down and lock into place. The backrest is movable. Pull up again and the backrest is fixed. The lever for adjusting the tilt angle is located on the right-hand side. Press the lever down, then the inclination can be adjusted. Pull up again and it is fixed once more. The PHYSIO Evo F has a footplate for height adjustment. It can be operated with the heel. When the footplate is pressed, the height can be adjusted. When it is released, the height is fixed. That was the introduction to the KaVo uniQa. We hope you enjoy your unique dental unit.